That time of the year again. At the end of the year, when I try to figure out what I want to buy before year's end. And so I'm going to walk you through the office, our office, and talk about 10 things I just want to make sure you might consider to have in your office. Number one is loupes. I don't run across many dentists now that don't have loupes, but if you do any kind of dental work, you need to be able to see. You need to be able to see to do. So you need to have loupes with some kind of magnification and your bright lights, just so you can see where it is that you're working, because the magnification actually decreases the amount of light that gets to your eyes. So you got to illuminate a little bit more. All right, let's go look at some other things I recommend that you have. All right, another thing I recommend that you have, well actually two things. So here's a benchtop composite warmer. You can put the whole gun in there, you can put syringes of composite in there, or you can put lots of compules of composite on the side so you keep it really warm. What's the advantages? We've talked about it in our past programs. You get better adaptation of your material to the preparation. It's easier to work with because you can take a really hard composite, and once it's warmed up, it gets much softer. It's easier to spread, and you can handle it better. And also, warming has been shown to improve the physical properties, the depth of cure, your hardness, polymerization. A lot of good things happen when you warm your composite. So you might have a benchtop warmer, or as we've mentioned before in other programs, you could have the phaser. The phaser, the compules fit in the phaser. It warms that compule right at the very end. And it's using that near infrared technology to actually warm the composite up. So again, it's going to flow better. And we all need to have a composite gun, so why not have your composite gun and your heater all as one? Another piece of equipment, and I have 3 different types of this, is air abrasion. Air abrasion prepares the surface if I'm doing a ceramic repair. Sometimes I can prepare a tooth. Sometimes I just clean out decay, or I clean out the internal aspect of my Emax or zirconia restorations. So what I recommend is some sort of air abrasion. Air abrasion, this one connects into my quick disconnect where I have my high-speed handpiece. I have another one if I need more air pressure that pops right into my delivery unit. Then I have another standalone, a prep start, that I can actually prepare teeth with, so it's a little bit more heavy duty. It has water and air. But I would recommend you have some sort of air abrasion. Air abrasion's been around for a long time, and I can actually prep a tooth using air abrasion in some circumstances. Buccal fillings, cervical fillings, without even having to numb the patient up, and they really appreciate that. And this is technology that's been around for decades, and my patients say they're always amazed how we have new technology in our office. All right, on to the next. All right, here's another item that I recommend that you have, and that's a curing light. Why a curing light? Because most of the materials that we use, you have to cure that material to get it to set. It could be a resin type of cement, even if it's dual cure, and it can be our light cured composites. I want to make sure that my restorations are completely cured, because if they're not cured, it's going to break down earlier, the patient's going to have sensitivity, it's just not going to be a good thing. Now, we've all been using old technology. What's the old technology? The blue light curing lights. What's the new technology? Again, let's use a quad wave curing light that's very bright, high intensity, and because it has that near infrared technology, it's going to cure deeper, it's going to cure better, and that just means we're going to have better success, and our patients are going to have longer lasting restorations. Now, I want a curing light that's durable, that has many different modes of curing, but the pink wave curing light has a very low profile, so we can get way back into the posterior teeth. It comes straight down over the tooth, so we have very little shadowing of our preparations. Again, things that we've talked about in our last programs. So if you don't know what I'm talking about, go check out the programs we've done in the past. And that very large lens. Remember, this lens is over 12 millimeters in diameter. So if I'm curing veneers, let's say on a central, I can cure the whole veneer in one fell swoop. If I'm doing the occlusal or onlay or crown on a molar, I can cure everything, because this will cover the entire occlusal surface area of that area of the mouth. The pink wave curing light, if you don't have one, you need to get about 5 or 6 of these. It's going to save you time, and you're going to have greater success with all the restorations that you have to light cure. On to the next. Another piece of equipment that I use in my office, and I've talked about it in a previous YouTube program, so again, if you don't know what I'm talking about, go check it out, is we use the K7. The K7 is a way that we look at a patient's jaw and the muscles. So what I'm trying to do, if I get a patient that comes in, let's say we're going to do a full mouth rehab, or we have a patient that's suffering from headaches or other TMD symptoms, what we do is we put pads on 4 muscle pairs and actually look at the EMGs to try to figure out where does the mandible want to be, and then we try to stabilize the area. It could be for a night guard, it could be for an orthotic, something that's more therapeutic. But I use technology now because we can show our patients what's going on with their jaws. These squiggly lines may not mean a whole lot, but if I come over and get into the patient education mode, I can show patients how the muscle readings differ when their jaws are in different positions. All right, and then what we can do is we can actually track where the jaw wants to go with the teeth not engaged, and make sure that when the patient does bite down that they're along that trajectory, that physiologic trajectory. So we can actually objectively show the patient the status of the muscles before treatment and after treatment, and we can explain to them how we're going to get there. So the K7 is something that in our practice we use quite a lot if you're doing airway, TMD, full mouth rehabs, or just diagnosing a patient, trying to give them some education about what's going on in the mouth. On to the next one. 2 other items I use when we're doing root canals is I use the Canal Pro X Move, and I've talked about this in other programs. Why? Because then I don't have to do all the filing with my fingers. It makes things so much easier. It can work in a rotary motion, a reciprocating motion. You can program it for whatever files as far as torque and rotation and RPM. And it's preset for the Colteen endodontic files, which are the files that I use. So I like to have the Canal Pro X Move because you can get back into the posterior teeth. It makes doing a root canal so much easier. And it has a built-in apex locator. So as I'm going down the tooth with my files, I can see exactly where my working length is. On to the next. All right, again, when I'm doing endodontics, and we talked about this, the Endo Ultra. The Endo Ultra supplies ultrasonic energy to my irrigants. So we talked about this in prior YouTube programs. If I'm just putting the irrigant passively down into a canal with my syringe needle tip, we're just going to flush things out. But I'm not going to be able to get that irrigant into lateral canals and all the nooks and crannies along that canal into the anastomoses. So what I'm going to do is I'm going to use the ultrasonic energy that's delivered by the Endo Ultra, and the Endo Ultra is going to push all that irrigant out. We're going to get the dental mud out. We're going to have a much cleaner canal. And as we talked about in prior YouTube programs, that's going to be very important for us to have success. Because one of the things we've talked about is if a patient comes in to us as a restorative practice, sometimes we can do the root canal, and while we're doing the root canal, we're milling out their final restoration, the crown, so they get everything done in one visit, our patients. But what's really important is that we know we're going to have success. So we need to clean those canals out very well, and then use a bioceramic sealer. The regen type of sealer is my preferred sealer to seal that area up and have true endodontic success. And then we cement the restoration on in that same appointment, and we are done. It's so convenient for the patients to get all done when we can do everything in one visit, the root canal and the restoration. On to the next. Another piece of equipment that I think everybody should have in their practice is a CBCT. Now you don't have to have this CBCT, it's a pretty big CBCT. But today the manufacturers are making CBCTs that will fit in almost any practice. If you've got enough room for a panel machine, you've got room for a CBCT. Why a CBCT? If you're doing a root canal, you can see how many canals it is that you have to treat. If you're doing an implant, you can see how much bone you have, the width and the height of the bone, and see any important anatomic features in that implant, proposed implant site. If you're treating TMD, you can see what's going on with the joints. Is there enough space for the disc, for example? If you're treating airway, if you've got the right software, you can see the size of the airway. Having a CBCT can be helpful when doing ortho. You can see the bone. Sometimes some units will give you a lateral ceph. But having more information helps you to communicate to your patients, increases your case acceptance, and you can do more treatments when you're confident that you understand what things are in 3 dimensions, not just 2. On to the next. One other thing that you need in your practice is a camera. It doesn't have to be this big. There's a lot of different cameras out there. There's some point and shoots, but you need to have a camera so you can document your cases. I use mine to take really clear photos that we then put up on the big monitors in the operatory. Take a big smile photo, put that smile photo on your monitor in your operatory, so when your patients are staring at it, they can pick apart their smiles, things that they want to improve. They don't understand what you can do for them, and they don't understand what questions to ask you about unless they can actually see the problems or the issues close up and magnified. I take a lot of photos for my lab communication. So even if I'm doing a single unit crown, I'll take some pre-op photos, and that way the lab can see what the teeth around that single crown look like. The occlusal pit stain, the gingival blend, and so much more. There's so many things that you can do with your camera that you need to have one. I've got three. I have one lens like this with a ring flash. That way intraorally we have less shadowing. I have a 2-point flash so that when I want to have more depth, we'll create some shadows so I get that depth. And then I have another camera that's just for portraits. So I have 3 cameras set up for the 3 different uses that we have. Now today there's some cameras that can do all 3 very easily, so you might look into that. But having some sort of way besides your intraoral cameras that you use all the time to grab those photos, I think is of great value. All right, that's it. Some suggested pieces of equipment to acquire at the end of 2024. And if you're watching this after 2024, then maybe 2025, actually anytime. These are pieces of equipment that I use in my practice constantly. They add value to the way I practice and make my job much easier. We want you to have the easiest professional life you can have. And at Vista Apex, we're committed to your professional success to give you a better life. And what we're doing is we're creating this community of like-minded individuals. So I hope that you'll hit subscribe and keep watching the programs, because we have a lot more information coming up in future episodes. And please send in your suggestions, things that you'd like to have us discuss more. And we want to create a sharing environment. So as we end out 2024, on behalf of Vista Apex, we wish you a happy holidays, great health, and a prosperous 2025. Take care.